to this special edition of Focus on Health. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Sarah Arnett. You are the Vice President of Patient Care Services and Chief Nursing Officer. So you are a key player over there at Peninsula Regional Medical Center, and you were nice enough to come in so that you could update us on where we are in terms of the COVID-19 outbreak. But I think one of the first things you wanted to do was go back a little bit in terms of how PRMC was getting prepared all along when we knew this was looming.
Yes, actually, when we first determined that we were going to need to be prepared for a pandemic response, we did a couple of things pretty quickly. We engaged with our local health department and our state officials in Region 4, the state of Maryland Region 4, to determine what our resources would be and what was available to us for surge capacity, not only in our emergency department, but in our inpatient setting as well. We worked with the state officials who were sending us projections on what we should expect, and also some expectations set forth by the state of how we should look at capacity management for our inpatient units, predominantly critical care and med-surg. We were expected to, at a minimum, double our critical care capacity and at least a 30 to 40% increase in our med-surg capacity as well. So we immediately went to work both on the ED capacity surge as well as the inpatient surge. We were working with our health department and were able to secure our Region 4 medical tent, which folks in the community may have seen out in the parking lot next to the emergency department. That's a 20-bed tent that we could use for ED patients. We could also use it for inpatients if it was absolutely necessary, but we did choose to use it for emergency department surge. We also worked with the health department to look at supply availability and work with them on what our other hospitals in the area were doing so that we could all be prepared at the same time. We have collaborative relationships, of course, with Nanticoke as our health system partner, but also with AGH as a regional partner, and we participate in weekly discussions with them as well on how we can all prepare together and at the same time ensure that we are all supported. We actually were able to reconfigure our hospital to meet the expectations that the state put forward as far as ICU capacity and our inpatient capacity.
Well, it sounds like you were getting your ducks in order, and that was several weeks ago. So where are we now? Where are we now in terms of various issues? And I guess you can address each of them, whether it's PPE, the personal protective equipment, or testing.
So where we are today, we actually are seeing a little bit different of a trend thus far from what we were expecting. We were expecting a surge and influx of critical care patients on ventilators, which is what some of our neighboring states and other states throughout the country and other countries were seeing. So we did prepare greatly for that. We expanded our conference center down in Hollowell to over 40 beds for ICU capacity expansion. We've secured additional ventilators, and we're working with our suppliers, our medical suppliers, to make sure we have enough PPE. We monitor our PPE on a daily basis and ensure that we are watching trends for utilization, and the trends not only for daily utilization, but for our patient flow as well. So are we seeing an increase in patients that explains the utilization, or are we looking at some other process that we need to redefine? So we do look at that every day. We also have expanded our inpatient medical capacity by 50% as well. So we have nurses that have been gracious enough to learn new skills, working in different areas, being redeployed. We've looked at all of our workforce. We have a lot of people that do non-clinical things with clinical backgrounds, so we're working with them to enhance their skill set and be able to put them back on the front line if needed as support staff for our current clinical team. As far as other things that we're doing and what it looks like now, we are seeing certain subsets of our community that are being impacted more so than other subsets. So we're making sure that we're working with their community leaders within their certain demographic groups to see how we can support them best and help them through this crisis as well. So we have our population health team that's done a great job at reaching out into the community, along with the health department, to see how we can support the community members that are being impacted the most. We certainly have seen a decrease in our overall ED volume, which has allowed us, fortunately, to care for the surge of patients coming through the ED with the COVID complaints, the cough, shortness of breath, those kinds of things. We are seeing a lot more folks that need medical level care, not intensive care, but a regular medical unit or our step down level of care. So we've had to reconfigure our staffing patterns to meet that need versus what we were initially anticipating. So we've done a lot of pivoting and turning and reconfiguring as we go, and it is a day-to-day, sometimes hour-to-hour transition depending on what we're seeing. As far as testing, that has been a rate-limiting step for us and has challenged us as far as patient placement and things like that, because if we had a test that we could do immediately, we could place our patients according to their need right up front versus waiting for a test to come back a couple of days later. We are seeing an increase in that capacity here at PRMC, but it's certainly not where we would need it to be. And we're working on a day-to-day basis with our lab personnel, with the state, and we're reaching out to the folks that we know that could help us facilitate that. It's not a struggle just unique to our hospital. A lot of hospitals, particularly in outlying non-urban areas, are facing that struggle. Non-academic center hospitals face that struggle. So we are working through that as well, but we have seen an increase in capacity to do that, but not nearly what we need it to be.
Yeah, that's what we're hearing. Lori Brewster from the health department, concurs that we're just a bit behind on the testing. And just your thoughts, if you don't mind, on, I guess the Eastern Shore is a little bit behind the metropolitan area of Baltimore and so forth. So I guess you're still waiting for numbers to increase perhaps? And I know you mentioned flexibility is key here.
Yes, flexibility is definitely key. We have seen that we are about a week and a half to 2 weeks behind our metropolitan colleagues in what surges that they're seeing and the levels of care that they need to provide to their patients and communities. We are seeing an increase in our volumes. While we're not going to be discussing specific numbers, I can tell you that we have seen an exponential increase in the number of patients coming with COVID-like complaints. Our admissions are increasing a little bit as well from those patients that are presenting to the ED. So we do monitor every day, certainly the state of Maryland website that shows the number of positive cases that increase overnight in 24 hours. And we're monitoring overall hospitalization rates throughout the state. And so it gives us a gauge of what we can look forward to in the next few days to weeks to come as far as where we might fall. So we are trying to do our best to stay a step ahead of that. And when we look at the trends that we are likely to face, we kind of try to plan ahead for that as well over the next week, 2 weeks, 3 weeks, depending on what we're seeing on across the bridge on the Western Shore and in some of our neighboring states as well.
And so the staffing levels are good, you feel? Because I know we're getting our seniors ready to go as of this week.
Yes.
Instead of the usual mid-May.
Yeah, staffing is always one of those challenging topics to talk about because it depends on what your patient population looks like. If we have patient population X, I could say, yes, our staffing is outstanding, but if we have patient population Y, as an example, our staffing might look different and might not be as robust as we would like it to be based on the patient population. But I will give absolute credit to every clinical person, non-clinical person here at the hospital. They have been very accommodating, very flexible, and extremely open to doing what we need to do to support our community from a staffing perspective. We have folks working additional shifts, staying over past their shift, coming early, learning new skills. So I think from a staffing perspective, we are in a much better place than some of our colleagues at other hospitals, not necessarily here in the Eastern Shore, but just in general when you look at the stories nationally on the news, and an overall preparatory place too. We're in a really good place compared to a lot of our colleagues that we're seeing on TV that are struggling in the stories that we're reading in the newspaper and things like that. So I am very proud to say that our team has done an exceptional job of making sure that we're ready for our community.
Again, it sounds like a lot of hard work being done in both preparation, flexibility, and just coming together, as an organization to meet the need.
Yes, and our community has been extraordinarily generous as well. We've had offerings on a regular basis of food. We had an anonymous donation the other night, for example. A gentleman had pizza for the entire hospital delivered. It didn't matter what your role was, you were getting dinner that night. And not to leave anybody out, but that was one of the more recent examples. But we've had physicians, support our nursing staff and our ancillary staff and EVS staff with meals and just kind words and support, prayers. We also have a lot of folks that have donated PPE. We got some support from our local education folks, both at the high school level and the county level and the college level, that shared their PPE and some of their equipment with us. So we've had a very open and extraordinarily generous community response to this as well.
So Sarah, I know the health department plays a major role in this contact tracing. We're hearing a lot about that and how that might help us start being able to flatten the curve and get back to normal. So how does the hospital work with the health department in that regard when you have cases of COVID that are, that come to the hospital and or admitted?
Mm-hmm. So when we do our testing for our patients here, whether they are tested in the ED and sent home or they're tested and admitted, when we get a positive result back, our infection prevention team here at the hospital reports our positive cases to the health department, whether it's Wicomico County or any of our surrounding counties, dependent on where the patient lives. They report the positive test, and then they share the patient demographic information, and the health department takes that from there and moves forward with their contact tracing out in the community with church contacts, work contacts, friends, family, things like that. So they do a lot of the heavy, actually most of the heavy lifting when it comes to the community contact tracing.
So it sounds like you have a very important relationship with the local health department in terms of communication.
Yes, we do.
So also, let's end on some positive notes. I know one of which is you have had, for the most part, very positive outcomes as far as patients that do come in and are admitted with COVID going home.
Mm-hmm. We do. Actually, what you see on the news is a lot of the negativity that comes around the context of COVID and the illness that it presents and what the challenges are with it. I can certainly say that we do have a lot of positive outcomes here, and we've had a lot of success stories for our community members. One of the things that we recognize to our staff when a patient who is diagnosed with COVID is discharged, we have a little song that they know when that's played that a patient with COVID went home. So we certainly have just a little symbolic thing for the staff when they know someone's leaving, so that they know they've done a great job moving that patient forward and getting them back to their community.
So it's great news for the patients, and of course, very motivational for the staff, because I know everyone over there is just hardworking and dedicated, including yourself. And if you wouldn't mind, before you go, would you like to give us a few tips to our viewers on what they can do to prevent or reduce their risk of getting COVID?
Yes, absolutely. Certainly follow all the guidelines that are put out by your local and state health departments. Washing your hands, social distancing, those are the things we've been hearing about since the inception of COVID in our area. But certainly any updates can be found not only on our hospital website, which is www.peninsula.org. We have the COVID section at the top that you can click on, and it gives you updates and the latest information. Our community relations team is exceptional at updating our Facebook page as well. So anything new that impacts visitation or the hospital or our community that we're sharing with the public can be found on our Facebook page. And then we also have partnered with the health department, again, another partnership that we have with them for a COVID hotline. And that phone number is 410-912-6889. And they are available during the day. So you can call them and they can provide you with information on COVID, or if you're having concerns over symptoms that you're having or anything like that, they can direct you the correct way to seek care or provide you with information on how to do some self-care.
Well, great, Sarah. We'll post all that information at the end of the program. And thank you so much again for coming on to let our community know how PRMC is ready, willing, and able to take care of us during this time of COVID.
Yes, absolutely. Thank you. It was my pleasure. Thank you for having me.
And thank you for joining us for this edition of Focus on Health here on PAC 14.